And you're talking about Adirondack Medical Home. That was a pilot program for 5 years that looked to bring together providers, insurers, team up with hospitals to improve care in rural areas, to try to advance preventative care, to try to cut down on patients who end up with chronic illnesses and end up in the emergency rooms. And looking back now over that 5-year program, what do you take away from it? How well did it work? And were there lessons learned from that that are being applied today?
You know, I take that and there's so many lessons, there's so many successes. It was a 5-year pilot. It was extended for 2 years, and we're reaching the end of that. And we're now in negotiations with the various payers and governmental agencies on how we can move it from a pilot into the Adirondack ACO and build it into the contracts with the various providers. It's been so successful. We just got some preliminary data from Medicaid on, and they actually did a really amazing study that compared 19,000 patients in our medical home with 19,000 people in upstate New York that are not in our medical home, but they're all covered by Medicaid managed care. And really large population, and we think this is going to be published as a report nationally. And we saw a significant decline in hospital admissions. People were they had preventative medicine, kept them out of the hospital. If there are these things called PQIs, preventable quality indicators. So, do you have a readmission? When you're discharged from the hospital, do you somehow fail in your recovery and have to be readmitted? That's preventable in many cases, whether it's medications or early intervention, and we saw a significant decline in those. We were, I think, 80% less than the control population. Think about that. We were 20% as likely as the control population to be readmitted.
That's significant.
It was one of the more rewarding data to see in my career, so we're excited about it getting published.
You teamed up with the Hudson Headwaters for that project, and some grants for this year were just announced within the past month or so, and one of the projects being funded, $3 million, is for a new clinic up in the town of Champlain. That's an example of where, again, trying to reach into the more rural areas, not that far from Plattsburgh, but just far enough, 25 miles, and that clinic really makes a difference in that small community.
It does, and I was actually talking with Dr. Racine, who was the independent physician up there. Actually, he was talking with one of our medical directors, Dr. Rietzema, and just said it's working great. Really had positive things to say about their protocols, how they take care of patients, how they really work to make sure, physicians nowadays, especially in primary care, while they're the captain of the ship, they got a big crew. And they have behavioral health in that office. They have a care manager in that office. They have access to pharmacists. They have all these different resources that are, you get just by being in that practice that have been the result of the medical home.
So they get mental health counseling. They get a number of other services.
Yeah, the Clinton County Mental Health has, under Sherry Gillette's leadership, it was started, and Peter Trout has worked very hard to continue it. They have taken mental health providers and embedded them in primary care offices, and there are a number of them across our whole community that have this. They're in Malone, they're in Elizabethtown, they're here. It really, really works well. It makes a difference. And one of the other grants in the program you were just talking about went to Behavioral Health Services North. Because if you go to their clinic on Route 3 towards Morrisonville, they do a wonderful job there with mental health services, but there's not a robust primary care center with that. And so one of the things that we've seen through data is that many people from that practice, when they need medical care, use our emergency room. Most expensive setting that there can be to deliver that type of care. And so they got a grant, and we'll be working with the community to develop a primary care center on that site. so that you deliver those in a co-location.
One-stop shopping
One-stop.
really makes a difference.
Right, it makes a difference. And you know, I tell people it's all about these personal connections. I am the one. I tell everybody this because it's a good story, and I don't mind saying it. I have mild asthma. I developed it as an adult. It's exercise induced. Every quarter, I get a letter from my insurance company about medications and asthma, and you know, I get home at the end of a long day, and you know, I want to read that about as much as a hole in the head. And I don't think I'm any different than anybody else when you get home. Yet, if I walk into my primary care physician and the nurse says to me, "Stephens, I see you haven't filled your inhaler recently." You know, it's like, you know, in this case, it's like mom. You know, I've let my mother down, and I have this personal relationship, and it's very impactful to me. And that relationship, that personal relationship, is what helps change people's behavior. And you know, then I go get my inhaler filled, and I do the right things. And you know, so we're all similar in that. You know, we get affected by relationships, positive and negative, and it's really important.